This is Dr. Caton over here at Baylor, Dallas. We're hung out with Dr. Mark Barisa, one of our neuropsychologists at Baylor Rehab, Dr. Wander, a sports medicine doctor over at Keller, Baylor Medical Family Center in Keller, and Dr. Shrees Wiley and I, who are internists here at Baylor, Dallas. And the subject today is just, we were talking about last month, multiple concussions, total brain injuries, and what has been interesting that brought this to light even more is a major lawsuit that was $765 million that the NFL has paid to some of the former football players that have been there, specifically like Junior Seau, who unfortunately, when he died, his brain was donated to the National Institute of Health, and they were worried about what was called chronic traumatic encephalopathy. And some of the issues that have come up from this is a brain disorder, and talking about in regards to suicide, etc. And what we want to do is talk about the severe mood swings that has occurred from chronic traumatic encephalopathy or from injuries such as concussions. Most of us, with the football season coming upon us, have young kids, either ourselves, nieces, nephews, someone we know who may be playing football, soccer, or basketball, and we've assembled this panel today to discuss about concussions. And one of the things is I'd like to just have you both, all three of us, introduce ourselves. Dr. Barisa?
Hi, my name is Mark Barisa. I'm the Director of Neuropsychology for the Baylor Institute for Rehabilitation. I've been here about 6 years and been working with brain injury, including sports-related concussion, for about 18 to 20 years now. So I'm happy to be here today.
Thanks. Dr. Wander?
I'm a family and sports medicine doctor in Keller, and I've been dealing with sports-related injuries since I've been here over the last 3 years, and happy to be here this morning.
Thank you. Dr. Wiley?
Hello, I'm Dr. Shrees Wiley. I'm a practicing internist here at Baylor University, Dallas. I take care of adult patients along with Dr. Caton, but this is such a great subject. I actually have a son who plays football, so I'm very interested in this topic today. I'm excited for you guys to be here. Thank you for joining us.
And you are correct, Dr. Wiley. I have a nephew who just started 7th grade middle school football, and so we saw his game on Tuesday, and one of the kids actually did get hit pretty hard, and it brings up the whole concussion issue.
Yes.
So let's start simply. Dr. Wander, if you would take the first question. What we wanted to talk about was, we know what concussion is, but would you mind explaining to this to the public what concussion means?
A concussion is a disturbance in brain function that's caused by a direct or an indirect force to the head. And it results in a variety of nonspecific signs and symptoms. Most often does not involve loss of consciousness. And a concussion should be suspected whenever there's a presence of any one or more of the following symptoms, like a headache, physical signs like unsteadiness, impaired brain function like confusion, or abnormal behavior like a change in personality.
Shrees?
Yeah, I agree. That's my son actually had a concussion a few years ago, and that's exactly what he experienced. He had some nausea and vomiting. So those are things that, it's when you have a brain injury, traumatic, be it, through soccer or football, when you notice any neurological change, that is considered a concussion. I have a question actually for you, Dr. Barisa. Concussions are more than just getting your bell rung. They can be very serious, and if they happen frequently, I know that they can lead to a lot of devastating brain injuries and irreversible damage. What are some of the effects that the brain can have after one has experienced concussions, even a mild concussion? What do you see in your practice?
Actually, in terms of concussion management, it really is a mixed bag. We get about 90–95% of the patients we see, they're going to be back on the field within 7 to 14 days. The symptoms that Dr. Wander described, they're present, they come into play, and especially in the acute setting, shortly after the injury, these athletes will experience these symptoms sometimes to quite a severe degree. Structurally, we really don't see changes. So the CT scans are normal. What's actually occurring in this case is a metabolic change, a chemical reaction within the brain. There's an influx of calcium and potassium into the cell, and it puts the brain in a metabolic, or almost like a hunger crisis. And because of that, the brain doesn't function well. And for most of the athletes we see, even from kids all the way into adult, like I said, 7 to 14 days, that starts to normalize, and they're able to gradually get back to those activities. It's that other percentage that we see a lot in the news, the ones who have the multiple injuries, the lingering effects of concussion, and oftentimes we know that with multiple hits, the risk of a longer recovery period or the risk of more persistent symptoms is higher. And again, the more hits, the more likely we are to see some of those persisting problems. Again, those can be managed. Those can be, Dr. Wander's well aware, and you guys are well aware in your internal medicine practice, that we have ways to manage the symptoms as the recovery process goes. The most important thing is to make sure that these athletes don't get back on the field too soon. That we want to make sure that there's complete symptom-free at rest, symptom-free when we start getting them back to play with exertion, and then baseline cognitive performance as well. Those are the three things that we need to see before they start returning to competition, returning to contact practice.
So what you're saying is, I heard you say this earlier, you may not see anything on imaging, but I like the way you described it. You said it's the brain, it's a brain hunger, so it's more of the function of the brain that's abnormal as opposed to seeing something on imaging, a CT or MRI.
Absolutely, absolutely.
Well, that's interesting because I was thinking about this when I was younger. We used to play football. My twin and I are not what we would describe as very large people. We're a little thinner, and one of the things that we were talking about is when my parents were very, very worried when we would play football. I was about 5'6" at the time, and there was a 6'4" guy who hit me. I went on the floor. I can remember being told, get up there, tough it out. And as more and more children are playing high-impact sports, we've heard stories from other high school players, college football players, where they were told they couldn't recall their name, they just kept on playing, they were being tackled, and yet they were put right back in the game like myself. And are there other signs that parents should look for at home after their child's had what we think is a concussion? Dr. Wander?
Yeah, most of the time, as Dr. Barisa said, most concussions are going to be mild, but parents should always be educated about worsening symptoms. For example, changing or if their mental status becomes worse and worse and they start getting more and more confused, if they start having numbness or tingling in their extremities, certainly any numbness or tingling in their face or any seizure activity. If there's also something called the Glasgow Coma Scale, which is more for medical personnel, but if that's less than 15, that's something that would necessitate getting the athlete to the nearest hospital. But in general, most concussions, the symptoms are going to develop soon after the head injury. And but it is important to continue to monitor them over the next 24 to 48 hours.
One of my nieces is 16 years old. She had a good friend who's also about 15 years old, suffered a significant impact on the soccer field, and she had true concussion. She had impaired consciousness for a very slight bit, and she had nausea, vomiting, and she was really irritable. Her doctor diagnosed her as a concussion and gave her 7 days off from school. How long do most patients take off from school? Because aren't we told that if you try to concentrate too hard right after a concussion, we can actually make the symptoms worse? Dr. Barisa or Dr. Wander?
Yeah, I think there's some mixed messages that go out. In all honesty, we don't know exactly how long someone should be held from school or from all activities. I mean, if you remember, there was a football coach who got in trouble for locking a player away in a locker room. Mm-hmm. That's not the way we want to manage the concussions. At the same time, we don't want them doing the things that are going to make things worse. What I try to explain to parents, to students, to college athletes, is your body is going to tell you what you can and cannot do. So while I recommend to them to avoid texting, avoid video games, avoid a lot of these high-intensity, high-stimulation activities, if they go and do it, it's going to self-limit. If you can imagine, if you're having vestibular or dizzy symptoms and you're having headaches and you're having vision things that are changing and you go and play Halo on a video game, it's going to last about 10 minutes and the symptoms are going to self-limit you. And the same happens when they go to school. And school is still activity, it's brain activity, and it's still exertion, it's brain exertion. So oftentimes what I try and do in my practice is I want to balance. If we take these kids out of school for too long, and they're AP students, now they're so far behind, we're getting symptoms of anxiety and depression because they're worried about school. It has nothing to do with a concussion. Now they're so far behind in school, it looks like they're having persistent symptoms when it may be the anxiety kicking in. So we look at combinations of things like block schedules. We'll have them go for half days. We'll have them do work at home. The key for me is for a student, their job is school.
Okay.
And I want to make sure they maintain that as much as they can while putting in appropriate limits where they're not overexerting with that. But I do have a number of patients that the persistent symptoms I think sometimes are due to the anxiety over being pulled out of school for too long. And then oftentimes we see medications started very early in the process after a concussion. I've seen it even in the case of the day of a concussion, someone starting on some of these medications to help with alertness and things like that. Then it's hard to monitor the symptom progression. So I think each person, I take an individualized approach with every case that we see. And I think that's the key to good concussion management, is realizing every athlete, every person that walks in our doors is an individual. And we need to adjust to their needs while managing the concussion.
Yeah, I agree. If I could just add that, yeah, concussion management, there's no one way to do concussion management. Every patient is different. The type of injury that is received, sometimes an athlete is blindsided and they get hit in the head and then they fall to the ground and hit their head again. Some athletes have coexisting medical problems like learning disabilities, ADHD, depression, anxiety. We also know that females tend to take longer to recover. The younger the athlete is, it takes them younger to recover. And like Dr. Barisa said, each patient has to be individualized, and you have to manage it based off of where they're at, what their coexisting medical problems are, and then how they recover. And that's what makes it so interesting, I think, with the management of this. And we certainly, I see that too. With the longer we hold them out, the athletes do get more depressed because they're used to playing sport. That's their favorite thing to do. And sometimes I will, depending on the situation, sometimes I will allow them to do some light exercise, in the subacute phase of the management. But it's always an individual call. So.
Thank you very much, Dr. Wiley.
Yeah, I was going to say, so what you're saying is it needs to be a balance, and it needs to be individualized, which brings up my next question for either of you. What has been the response of the athletic programs in high school and college? A lot has changed over the last 10 years, with response to concussions. What you guys are involved in the community and involved with these children. So how have these guidelines changed? What are they doing in the community to respond to concussions?
I think most of the programs now have put in concussion plans. Whether the high school now with Natasha's law, there are legal issues involved. They have to be cleared by a physician before they can return to play. But even at the youth level now, I work with a number of youth programs that have put in pretty good concussion protocols and making sure that these individuals are safe. As Dr. Wander and I mentioned before, most of these kids are going to be back on the field relatively quickly. Concussion tends to be a 7 to 14 day recovery span. That's the normal trajectory. And you don't hear about those cases. The cases you hear about are the more dramatic cases that make the news with second impact syndrome or more persistent, really severe things. Those are not the norm. Those are the exception to the rule, but that's what has become concussion. And nobody wants to be the coach of that kid. No one wants to be the principal at that school, the athletic director at the school where a kid has a very severe subsequent outcome. And so everyone's taking precautions. And I think the pendulum has swung quite a bit. As Dr. Caton was mentioning, when we were playing sports as kids, I remember getting a line drive to the forehead and I was knocked out completely. I went to third base and finished the game. Now I would have been rushed to the hospital for a CP. Mine was not managed appropriately, I will say that. At the same time, when I see a lot of things on the media that are kind of pointing to chronic traumatic encephalopathy after one concussion or after some subconcussive blows, I get a little nervous. I think we're also throwing some misinformation, and we're creating some of the panic that has resulted in good care. It's resulted in leagues actually looking after the kids. But at the same time, we need to understand most of these kids are going to have a pretty rapid recovery, and they're going to do well. We just need to make sure we don't lose anyone through the cracks by saying, oh, they're going to be fine.
Right. I know, you know, dealing with my children with sports, you hear that a lot. The coach kind of tells them, get up, shake it off. And, you know, we talked about the athletic programs in high school and in college, but are we doing a good job in educating these little league, you know, coaches as well? Because they really don't have a governing body, so to speak.
Right.
You know, there are a lot of independent, you know, we call those specialty, you know, sports. So are we doing a good job to educate them as well? And is there any legislation in place or any rules in place for these other, you know, specialty sports that are not connected with high school or college? Do you know, Dr. Barisa?
At this point, there are none.
Mm.
There are none. Thankfully, at Baylor, we have some pretty strong connections with some of the youth leagues within the Dallas-Fort Worth area, and we're providing that education. I went into 2 different coach clinics for the youth programs in the area and provided just education strictly on concussion, and was very well received. And the coaches themselves admit, we don't know what we're looking for. And you know, they've adopted the when in doubt, sit them out philosophy. Oftentimes it's the parent that then subsequently says, why is my kid not playing? So it has to be balanced on both sides. We need to not only educate the coaches, we need to educate the parents as well in a balanced format. Again, not trying to scare people, but just making them aware that we want to keep bad things from happening. And when you look at concussion protocols, the pros have the most extensive regulations. Well, they're the ones getting paid. The colleges then have the next most extensive. Well, they're almost getting paid. Some might be. And then at the high school level, most of them are not getting paid, depending on what school district. I don't know. But as we go down, there's less and less protocol. There's less and less care. And these are the most fragile. When I look at an 8-year-old out playing tackle football and they've got the helmet on, they actually look like a bobblehead because the head is so large. And that's where some of the injuries in the kids come into play. You've got a very large, heavy head with a helmet with a neck that can't support it. And that's what puts them at greater risk. And these are the ones we look at the least in terms of protocols.
Dr. Wander, what is your typical treatment for a concussion when a simple one, like we were describing, let's do the 80-20 rule, the ones that really affect us out there in the public? What would be your typical treatment for a concussion?
Well, first of all, you want to do a thorough neurologic assessment, rule out any red flag symptoms, rule out any type of spinal cord injury, any severe head injury. After you've done that and you've diagnosed them with a concussion, again, there's no blood test to diagnose a concussion. There's not yet, at least. There's no we don't have access to functional MRIs or anything like that. CT scans, MRIs will not diagnose a concussion. So it's more like Dr. Barisa said. It's more a functional impairment. It's not a structural problem. So once you've diagnosed it, then the first step is really resting them. And so we rest them physically and mentally. So physically, we're going to hold them out of sports. It's well known that when an athlete exerts themselves physically, their concussion symptoms get worse. And we're also going to, for certain athletes, we will give them academic accommodations. Sometimes we'll hold them out of school. We'll do half days of school. And then we'll kind of follow them, usually on a weekly to twice weekly basis, depending on the athlete, and kind of monitor them and change things up as we go along.
Dr. Wiley, did you have a question about some of the precautions or prevention?
Yeah, I did. Actually, I'm very interested in this. Again, I said, I have a son that plays football, and I have a 3-year-old now that plays soccer. So I want to know from both of you, what are some of the things that we can do as parents to prevent our children from having concussions?
Well, you could pull them out of every sport and not have them play anymore, but I don't think that's a very good idea. I honestly believe I coach multiple youth sports. I'm very involved in youth sports. I don't coach football, but I am involved with basketball, baseball. I'm involved with soccer, and I think they're great things for our kids. I think it promotes a healthy lifestyle. I think it promotes teamwork, and I think it promotes character. At the same time, the best way to manage concussion is to prevent it from happening, and that's teaching proper tackling techniques at the appropriate age. It's teaching proper heading skills in soccer. It's teaching appropriate team play and sportsmanship. A lot of the injuries that we see at the youth level, the kids that I see, sometimes they're actually due to, not necessarily intentional, but reckless play. And I think part of what we can do in youth sports is teach the appropriate way to play the game and the safe way to play the game. We are still searching for that magic helmet that will stop all concussions. I don't think they're going to find it. I don't think that's going to exist. So anytime you're in a high-impact sport, there's going to be the risk. But the way to manage it is to play the games properly, have appropriate rules in place, and teach the sportsmanship involved for fair play. And I think that's a big part. Other than that, we just want to make sure we watch, and if we have signs that someone was injured, if we're in doubt, we pull them out of the game. And we monitor and we check first before we let them return.
Dr. Wander?
Yeah, that's exactly right. And I'd like to add that there is some research out there to suggest that neck strengthening exercises can help strengthen the neck muscles and dissipate some of the force with a head injury. Now, certainly, if you get blindsided by another athlete playing football, you can have the strongest neck muscles in the world, and you're still going to get a concussion. But yeah, I think that's something that's important to do, at least in the preseason, working on strengthening the neck muscles, and that ties back to what Dr. Barisa was saying earlier about the head-to-body ratio is different in younger athletes, and the neck muscles aren't as developed in the younger athletes, and that might be something that predisposes the younger athletes to concussions.
Well, one of the things I think that's interesting is we were at a football game, and one of our fellow parents was logging on to the website while we were sitting at the football game to look up concussion. And it was very interesting. It's www.cdc.gov/concussion. And she printed it out for me, and I'm going to just put it in front of the thing for you. I don't know if you can see it. That's the first part. And it says it's heads up. It's a heads up program from the CDC. And it gives some of the symptoms for concussion. Some of that's also available. We'll have a lot of this discussion on the Baylor Health website, baylorhealth.com/sports, sports medicine. And then one of the other things that they asked us to do is just talk about the Heads Up program that is available by the CDC and regulated by other doctors just like yourselves. Dr. Wiley, any closing remarks?
Yeah, I know that they have that program, the Heads Up program, and I think it's, I spoke about having regulation or legislation for, our younger children who are most vulnerable to injury. I think, if I wanted to, or if I needed to stress anything to our community, it would be to, encourage your coaches maybe to take a look. I viewed the Heads Up program on the CDC, and I think it's a great learning tool just to help us, be able to recognize, know what to do in the event of a concussion. So, again, to the community, visit that website, encourage your coaches to take a look at that website. That's what I plan on doing.
Dr. Wander, any closing, or Dr. Barisa, any closing remarks?
Yeah, I should have mentioned that also. The youth leagues I work with are following that Heads Up program through the CDC. It's a fantastic program, and my final comments would be just to make sure we watch and we take care of our kids. Having a concussion is not going to necessarily permanently remove them from play, but we want to at least get them out of the game that day and work with them to make sure that it's safe return. I think sports are great for our kids. I think physical activity, exercise, I would rather see a kid playing football on a field than football on an Xbox.
And Dr. Wander?
Always hold on to that.
Yeah, I agree. I grew up playing a lot of different sports, and sports have a special place in my heart. And as far as concussions go, I think the most important thing is just recognizing them, being aware, of the signs and symptoms of them. You know, symptoms are things that the athletes would report. Signs are things that parents or coaches would see. And then holding them out if there's any suspicion of a concussion, and get them to someone who is aware of them. And the best treatment is really managing them, or the best prevention rather is really just treating them appropriately and not letting them back to the game too soon.
Well, thank all of you for being on this early in the morning and giving such good information to all of us as uncles, aunts, parents, grandparents. So once again, we just want to recommend looking at that website, www.cdc.gov, concussion, or looking at baylorhealth.com/sportscare. Thank you all very much for joining us today on Hangout.
Thank you.
Thank you.
Bye.